I'm thrilled to be here. As Rachel mentioned, my name is Erika Ramirez. I am a patient services case manager. I have been with PanCAN since the start of this year. Like many others learning about the disease, I had zero idea of the important role the pancreas plays. So during this session, I will be providing an overview of pancreatic cancer, including basic information about the pancreas, risk factors and symptoms of pancreatic cancer, and treatment options. I'll also provide information on what myself and the rest of the PanCAN Patient Services team can do to provide support and resources to patients and families facing a diagnosis. And I will share my screen. I realize I did not do that. I apologize. And can everyone see my screen?
Yes, that looks good.
Okay, perfect. Thank you, Rachel. Okay, so as I mentioned, I'll be going over what PanCAN Patient Services does. But to begin, I will be going over a pancreatic cancer, overview of pancreatic cancer. So what is the pancreas? As you may all know, the pancreas is part of our digestive system. It is located deep in the abdomen between the stomach and spine. It is surrounded by the stomach, small intestine, liver, spleen, and gallbladder. And so what does the pancreas do? What is so important about the pancreas is it produces and secretes enzymes for the digestion of food, as well as produces and secretes hormones into the bloodstream. For example, insulin and glucagon maintain the proper level of sugar level in the blood. And so what are some pancreatic cancer symptoms? Someone may experience pain in the upper back or abdomen, changes in stools, jaundice, unexplained weight loss, loss of appetite, nausea and vomiting, new onset diabetes in people over the age of 50, and weakness and fatigue. However, please note that having one or more of the unexplained symptoms does not mean that a person has pancreatic cancer. However, if you are experiencing one or more of these unexplained symptoms, we urge you to speak to your doctor. Now, so what are some risk factors of pancreatic cancer? As with many other cancers, environmental and external factors also play a role in developing cancer. However, some risk factors for pancreatic cancer are smoking, obesity, age over 60, gender is more likely in men than women, family history, genetics, race, diabetes, chronic and hereditary pancreatitis, exposure to chemicals and heavy metals, and chronic heavy alcohol use as associated with pancreatitis. Now, some dietary concerns that a patient may experience as a result of their diagnosis are poor appetite, weight loss, malabsorption, and pancreatic enzyme insufficiency, and diarrhea. Additionally, a great deal of patients experience symptoms of insufficiency and are not aware that they can take enzyme supplements to help mitigate symptoms. And some other patients may also experience taste changes, overall discomfort, constipation, gas, lactose intolerance, nausea and vomiting, and also some symptoms after surgery. Now, how is pancreatic cancer treated? Depending on the type and stage, pancreatic cancer may be treated by undergoing surgery, either the Whipple procedure, distal and total pancreatectomy, chemotherapy, FDA-approved and regimens, radiation therapy, targeted therapy, biomarker-driven targeted therapies, and clinical trials, which may involve any of the above. Now, as mentioned in the previous slide, pancreatic cancer may be treated through biomarker-driven targeted therapies. This is known as precision medicine and can be done through genetic and biomarker testing. Rather than basing treatment decisions on the cancer type, precision medicine can provide information about a patient's biology and particular tumor to help guide treatment decisions. As every pancreatic cancer patient is different, Those who receive treatment based on their biology can live longer. PanCAN strongly recommends that all pancreatic cancer patients get genetic testing for inherited mutations as soon as possible after diagnosis, and biomarker testing of their tumor tissue to help determine the best treatment options. Genetic testing for inherited mutations can also inform family members of risk regardless of family history. So what are clinical trials and why are they important? Clinical trials are research studies that investigate new treatments. Pancreatic cancer clinical trials are the only way for researchers to determine whether new treatments are beneficial to people living with pancreatic cancer. Currently, only about 4.5% of pancreatic cancer patients enroll in clinical trials, slowing treatment progress. Clinical trials are important as they provide access to new, potentially better treatments, early detection and prevention, and new treatments and detection methods can be proven safe and effective. And as mentioned earlier, clinical trials are the only way that researchers can develop new treatment options for pancreatic cancer. Our organization strongly recommends clinical trials at diagnosis and during every treatment decision. So that was our overview of pancreatic cancer. Now we'll be going over what PanCAN Patient Services can do. So PanCAN Patient Services Helpline is our call center and is the foundation of everything we do. Patient Services is the premier source of quality, reliable information for people with pancreatic cancer, caregivers, and healthcare professionals. We can provide information on treatment options, give you a listing of pancreatic cancer specialists, symptoms and risk factors, the patient registry, biomarker and genetic testing, clinical trials, diet and nutrition, early detection, support and information, supportive care, and financial and insurance resources. And so a look into who our constituents are. 52% are caregivers, the majority of whom are women. 65% are first-time contacts. 67% of patients have metastatic pancreatic cancer. 82% are unresectable or not able to have surgery. 28% of patients are diagnosed but not yet treated. 84% of contacts come to us from online searches, 8% from social media, 2% word of mouth, and 1% from providers. So in the past year, our reach in the pancreatic cancer community consisted of 19,669 new patient and HCP contacts, 41,135 booklets and brochures distributed, 8,046 clinical trial searches, 19.7% of clinical trial searches for first-line patients, 17,480 views of PanCAN's patient education webinars, and 47,556 interactions with patients, caregivers, and healthcare professionals. So in the following slides, I will briefly discuss what we mean by helping patients get on the right track with the right team, the right tests, the right treatment, and how to share at every step. So by the right team, we mean consulting with pancreatic cancer specialists improves outcomes. Patient Services provides lists of specialists to patients every year. 28% of patient services survey respondents reported that we impacted the patient's decision to see a specialist. Your team may consist of a gastroenterologist, an oncologist, a surgeon, and/or dietitian that specializes in matters of the pancreas. And so as we discussed earlier regarding precision medicine, patients treated with matched therapy selected through biomarker testing have better outcomes. Genetic testing for inherited mutations may also review mutations that suggest specific therapies may be beneficial. Our Know Your Tumor Precision Medicine service helps identify treatment options for HCPs and their patients. 39% of patient services survey respondents consider biomarker testing. And excuse me. And with the right test, you may be able to find the right treatment. Pancreatic cancer patients who participate in clinical research have better outcomes. 40% of Helpline survey respondents pursue a clinical trial. And finally, how to share at every step. De-identified patient health data provides researchers with crucial details that can lead to improved treatments and better patient outcomes. 92% of our patient registry users join so they can share their information with researchers and other patients. We also provide a library of booklets to patients, families, and healthcare professionals. These booklets include an overview of pancreatic cancer, diet and nutrition, clinical trials, hospice, and supportive care. More than 41,000 booklets and brochures were distributed via mail last year, free of charge. Healthcare professionals can order booklets to their offices and clinics. Booklets are now available for digital download for patients. Everything is reviewed by PanCAN Scientific and Medical Advisory Board, which is composed of leading cancer scientists, clinicians, and healthcare professionals from institutions across the United States who specialize in pancreatic cancer. So one of our unique resources that we would like to share is our Survivor and Caregiver Network. Our Survivor and Caregiver Network is a peer-to-peer matching program of survivors and caregivers throughout the country who are available to communicate one-on-one with those diagnosed and their loved ones. And how do we match? We ask for the type and stage of pancreatic cancer, the treatment similarity, their gender, age, and geographical location. Another resource we have is our educational webinars that are open to the public to attend online. They consist of a presentation with pancreatic cancer specialists. Topics often include treatment approaches, surgery, diet and nutrition, and genetics. And there's also an opportunity for Q&A while the webinar is being held and afterwards. However, if you are unable to attend, it is recorded and archived on pancan.org and our PanCAN YouTube channel. Finally, a resource we would like to point out is the PanCAN Financial Navigation. We have partnered with the Patient Advocate Foundation to offer PanCAN Financial Navigation as an extension of PanCAN Patient Services' commitment to provide free, personal, one-to-one support to pancreatic cancer patients and their families. What this means is you have access to expert guidance to complex financial and insurance issues. As we at Patient Services are not trained in matters of financial and health insurance, the Patient Advocate Foundation fulfills that need through helping patients and their families coordinate all benefits, understand and enroll in health insurance, and navigate insurance with pre-authorization, appeal support, and coding and/or billing issues. As with our other services, this is also confidential and free of charge. So, if you would like to get in contact with a PanCAN Patient Services case manager to get more specific information on any of the topics I discussed, we are available Monday through Friday, 7 a.m. to 5 p.m. Pacific Standard Time by calling 877-272-6226 or by email at patientservices@pancan.org. And I would like to note that we do offer services both in English and in Spanish. So thank you for your time, and I am happy to take any questions you may have.
Thank you so much, Erica. It's so